Thank you for reviewing the 2015 through 2016 Employee Benefits Program for iidon Security. Open enrollment will be held from November 9th through the 20th of 2015. Benefits will begin on the policy year of December 1st, 2015. Enrolling in and making changes to benefits. This is your annual enrollment. The elections you make during open enrollment will go into effect on December 1st of 2015 and will remain in effect until November 30th of 2016. You will not be able to make changes to your elections unless you experience a qualified life event. Qualifying life events include things such as marriage, birth or adoption, death of a dependent, change in your spouse's employment, change in residence that affects your eligibility, FMLA leave, or you become eligible for Medicaid or Medicare, receiving a qualified medical child support order. What is not changing for the policy year beginning December 1st, 2015? The Humana dental plans and rates and the Humana vision plans and rates will remain the same. You will still be able to enroll into the AFLAC voluntary supplemental coverage plans such as accident, cancer, hospital indemnity, and term life. What is changing for benefits beginning on December 1st, 2015? The minimum essential coverage, MEC, and the minimum value plan, MVP, carrier is changing from Key Solutions, also known as Key Benefit Administrator, to Lucent, also known as North American Administrator. To enroll in the minimum value plan, there will need to be a minimum of 10 employees. You will have to submit an application and answer medical questions. The MVP rates will be determined once medical underwriting is completed. As a result, all MVP applications have to be submitted to HR by November 13th of 2015. iidon will contribute 100% of the employee-only premium for employees enrolled in the base minimum essential coverage plan. The individual mandate tax penalty for 2016 is the greater of the calculated percent of your adjusted household income or the combined per-person penalty for each person in your family. How to enroll. All benefit-eligible employees must complete a North American Administrator enrollment form. Even if you do not want coverage, you are required to sign the declination form. If you are waiving coverage, you must indicate the reason on the declination form. You need to include all of your personal information, such as your Social Security number and your date of birth, as well as those for all covered members on the plan. Enrollment in the MVP plan requires answers on the Employee Medical History Questionnaire page of the enrollment form. All MVP applications must be submitted by November 13th of 2015. If you are enrolling in the base MEC plan or the MEC Plus with H2U plan, you will have until November 20th to submit your application. Applications can be obtained from your HR department, or if you have questions about your benefits, you can call the Employee Response Center at 866-419-3518. They are available to take your call Monday through Friday, 8 a.m. to 5 p.m. Which plan works best for me? In order to determine that, you will need to know things such as how much you will pay in premium for the plan, how often you will see a doctor, if you're currently taking ongoing medications, how likely you are to have services that will be applied to your deductible, and whether or not you will need the flexibility to go in and out of network. Once you determine the answer to these questions, you should be able to find a plan that is best for you. Minimum essential coverage health plan options through North American Administrators will begin on December 1st of 2015. iidon Security is offering employees the following coverage that satisfies the federally mandated minimum essential coverage so you can avoid the ACA, Affordable Care Act, tax penalty. The MEC plans not only contain the preventative and wellness benefits required by ACA to avoid tax penalties, but they also cover things such as telemedicine, optional prescription drug coverage, online access to explanation of benefits, plan summaries, and much more. Preventative services are covered 100% in-network. Your coverage is provided through the First Health Network. You will have two MEC plans to choose from. The first is the base MEC that covers preventative as well as telemedicine. The monthly cost under the base MEC for an employee only is $0. The monthly cost for an employee plus child is $24. The monthly cost for an employee plus spouse is $49. The monthly cost for an employee plus family is $74. The second option is the MEC Plus with H2U. This plan includes all benefits offered under the base MEC plan in addition to a drug formulary card and an unlimited doctor visits with a $10 copay. The monthly cost under the MEC Plus plan with H2U for an employee only is $29. For an employee plus child, $79. For an employee plus spouse, $130. For an employee plus family, $181. Under the MEC plans, you have a benefit available to you that is called Healthiest You. Healthiest You is a comprehensive way for you to conveniently and cost-effectively manage your healthcare needs. Through a member-friendly smartphone app, you have access to a doctor 24/7, 365 days a year, along with tools that truly simplify healthcare. Physicians are available to diagnose, treat, and prescribe. They are provided to you at no additional cost. There are prescription savings of up to 85% at local pharmacies by comparing prices for all FDA-approved prescription drugs at virtually every pharmacy in America. You have the tools to compare costs and prices of more than 5,000 drugs at more than 100,000 pharmacies. You are able to track your deductible, connect medical insurance plans to instantly view in and out of network deductibles and minimize out-of-pocket expenses. You are able to connect with a physician also by calling 866-703-1259. Account activation may be completed using the online member portal at member.healthiestyou.com. Customer service contacts for North American administrators. For claims, you can contact them at 800-411-3650 or visit their website at www.naa-lp.com. For Lucent prescription drugs, you can call 800-411-3650 or you can visit their website at www.naa-lp.com. For the PPO network, for the MEC plan or the MEC Plus with H2U, you can contact them through First Health Network at 800-226-5116, or you can visit their website at www.firsthealth.com. For Healthiest You, you can call them at 866-703-1259 or visit them at www.member.healthiestyou.com. The Minimum Value Health Plan offered through North American Administrators effective December 1, 2015 is a bronze major medical plan that provides comprehensive coverage for inpatient and outpatient procedures. However, it has a high deductible of $4,500 for an individual and $9,000 for a family. The coinsurance for this plan is 80%. That means that benefits will not be paid until the deductible is met. In addition to that, your coinsurance under this plan would be 20%. Rates will be determined after medical questions are answered on the application. Your rates can be no more than 9.5% of your salary. The dental options for 2015 are through Humana. You have the option to select between two dental plans. One plan is a dental PPO and the other is the dental HMO. This slide shows a side-by-side comparison of the dental plans. Under the dental PPO, you have an annual maximum benefit of $1,000. Under the DHMO, you don't have an annual maximum benefit. It is unlimited. Your calendar year deductible under the PPO is $50 for an individual, $150 for a family under the PPO. Under the DHMO, there is no calendar year deductible. The Type 1 preventative services are covered at 100% under both plans. The Type 2, your basic services under the PPO, are covered 80% after your deductible. Under DHMO, you have a schedule of benefits that shows the copay for the type of services rendered. Under Type 3, which are your major services, you have 50% after you've met your deductible under the PPO. Under the DHMO, you have a schedule of benefits that will list the copays for the type of services provided. Under the Type 4, which are your orthodontia services, with PPO, you don't have orthodontia services. Under the DHMO, you do have orthodontic treatment. If you're 18 years or younger, the orthodontic treatment is going to be $1,800. If you're 19 years and older, it's going to be $2,100. This slide provides greater detail as to what is covered under the Humana Dental PPO. Under the Dental PPO plan, you do not have to pre-select a primary dentist. When you want dental services, make your appointment with any licensed dentist. When you receive treatment from an in-network PPO dentist, your cost will be reduced. Once services are performed, you or your dentist must file a claim form in order to receive reimbursement. Your claim will be paid based on iidon schedule of benefits. The plan will pay a percentage of the eligible charge up to the plan's annual limit for the benefits. This slide provides a brief summary of what is offered under the Humana Dental HMO, also known as the DHMO. Based on the extensive schedule of benefits, you will know up front how much your copayment will be, and for procedures that may not be listed on the schedule, you will receive a 25% discount off of the network dentist usual fees. DHMO plans are network-based products that emphasize prevention and cost containment. In order to receive services under the DHMO plan, you must select a primary dentist who participates in the DHMO network. You do not have benefits outside of the network under the DHMO plan. Vision Care Plan offers you and your family an outstanding benefit plan that covers all routine eye care, including eye exams and eyeglasses, lenses and frames, or contacts. The plan features in-network and out-of-network benefits. Exam Plus means if you prefer contacts, you get your exam plus an allowance for contacts in place of lenses and frames. Vision Care plans are network-based vision plans that emphasize high-quality routine eye health care from independent eye care professionals. Services and materials are provided on a prepaid basis, and the plan pays network doctors directly. Vision Care plan members can also use non-network doctors if they choose. The 2015 Humana Dental and Vision rates are as follows. These are the monthly premiums for the dental PPO. Employee only, $23.73. Employee plus spouse, $48.24. Employee plus child or children, $48.38. Employee plus family, $79.59. The monthly dental premiums for the DHMO are as follows. Employee only, $14.80. Employee plus spouse, $25.54. Employee plus child or children, $26.68. Employee plus family, $35.78. The monthly vision premiums are as follows. Employee only, $6.74. Employee plus spouse, $13.44. Employee plus child or children, $12.78. Employee plus family, $20.04. As an employee of iidon Security, you have the opportunity to purchase additional voluntary supplemental benefits. Below is a list of a few of the benefits available to you through AFLAC. These benefits include, but are not limited to, cancer, hospitalization, accident, and term life. To enroll or to make changes to your existing Aflac plans, contact Dennis Copeland at 972-996-4675 or email him at dennis_copeland@us.aflac.com. This concludes our review of the summary of benefits offered through iidon Security beginning policy year December 1st, 2015. If you have any questions regarding anything that's been discussed, you can call the Employee Response Center at 866-419-3518. They are available to take your call on Monday through Friday between 8 a.m. and 5 p.m. Or you can email them at helpline@higginbotham.net. Thanks so much for your time.